So, you know, one of those things that really comes into play now is with one of the newer therapeutics that's out there, which is radium-223. So, as many of us know, it's an alpha-emitting radiopharmaceutical. It's different from the betas and the gammas that we've used before. It has this unique mechanism of action that it's a calcium mimetic agent. And interestingly so, given the fact that it's really only targeting bone, it has a survival benefit, which to me I think is very intriguing given the fact that we're really not doing anything to manipulate the androgen axis, which we believe still plays a very important role. So now that we've got this agent that, again, fits into the whole paradigm of managing M1 CRPC patients, and again, depending upon what particular guideline you're following, whether it be NCCN or the AUA index patients, how are we, Richard, how are you offering this to your patients? What are you doing? Who you're partnering with to deliver radium-223?
So as stated previously, we administer this at our cancer center where we do external beam therapy, where we give Provenge, where we do brachytherapy. Our radiation oncologist administers it, so you can either have a nuclear medicine physician or a radiation oncologist. Once again, as Gary was alluding to, as far as dispensing pharmacies, there's heavy state regulation with this, and every state is different, and there are a number of hoops that have to be jumped through before you can get the regulatory approval from your state to get this going. It took us close to a year here in Illinois. But once it's up, again, it's another facet of the integrated care. It's a drug that we've been administering now for a number of months. The patients tolerate very well. We've seen marked improvement in them. It's, you know, obviously anecdotal, but nevertheless, I would agree with you that this is a great asset to have in our practice and to be able to extend this to our patients. We have it set up that everybody who is a candidate from our group is then referred in to the center and is evaluated by myself, who kind of runs the advanced prostate cancer clinic, and our radiation oncologist, and then they are approved for insurance, and then they are administered the drug on the 6 treatments over 6 months at the center.
Sandy, I know you guys are delivering also, correct?
Yes, we just started. As you know, there was a delivery issue that has been fixed, and production has begun again, and we do it exactly like Richard does it. It's done by our radiation oncologist.
Gary?
Well, we've been delivering for quite some time. It's been very successful. Again, this is delivered by a radiation oncologist. By law, it has to either be a radiation oncologist or a nuke med physician. We do deliver it at our center because we have the radiation license. As Richard mentioned, there are a number of regulatory issues that you have to comply with. It's been very successful. It's fantastic to have another option, another arrow in the quiver that's not just an androgen option. We now have immune therapy. We now have alpha particles. We have the androgen options, and the use of all of them together is resulting in revolutionary change for our patient care. This has been a very important addition to our practice in terms of us presenting a comprehensive package of care for the patient.
Neil, if memory serves me, didn't you deliver the first commercial dose in the United States?
Yeah, we actually did, and so I think I'm proud of that. So urologists gave the first dose. Our practice did right after it was approved in May of 2013. So we've had a great experience with it. Fortunately, in South Carolina, we didn't have a lot of regulatory hurdle. We had our NRC, Nuclear Regulatory Commission certification, and we were able to deliver it. I agree with everything that's been said. It's a 45 to 60 second infusion. The grade 1-2 adverse events are very low. It's virtually unheard of. Very single digits on severe adverse events. Patients are in and out after the infusion, and we follow them very regularly. So it's been a great addition to our armamentarium because, as you said, the unique mechanism of action, which just speaks to, again, everything we've talked about now, the ability to grow our ability, the advanced prostate cancer clinic.
So from the research side of